An announcement that you're making today, there's a 6-month extension of health services. What will this ensure?
So it's the continuation of telehealth, and this has been a revolution. Since it was instituted, we've had 30 million services provided to Australians, and that's meant support for mental health, support for coronavirus, support for general cardiac, cancer, respiratory conditions. So things which have really made a difference, but it's protected patients by allowing them to get the service from home. It's protected our nurses and our doctors by allowing them to treat patients without necessarily having to see them face-to-face. There's a huge role for face-to-face, but where the convenience and the safety have been able to be managed through telehealth, then that's an incredibly important step forward for the nation, for patients and for healthcare.
Are you expecting all of these measures to still be in place once we have a vaccine?
Well, telehealth we want to see as an abiding legacy of the coronavirus pandemic. It's something which we had planned on, but we had a 10-year plan which, because of COVID-19, we had to bring forward, institute in 10 days. We learnt that we could do something of that scale on a step-by-step basis and do it quickly. And so that's one measure that we think will be long-term and abiding. The home medicines delivery scheme has helped 1 million Australian patients have that home medicine delivery, and that's another element that could be long-term. Other things such as respiratory clinics, they're by nature temporary, but they have helped protect and save lives in Australia.
It's not fail-safe though, is it, telehealth? I know from my own experience going through telehealth and you've got a baby and you can't quite get the doctor to physically examine, and it might not just be a baby, it could be anybody, they can't physically examine someone. So it's got its limits, right?
Look, absolutely. Face-to-face is still the basis of our general practice services. This works for many particular types of consultations, but where a physical examination is needed, there's no substitute for that. And we want to encourage people to continue to see their doctor, not to neglect their checkups and their scans, particularly if there are lumps and bumps that are unexplained that need to be tested, if you have a baby with a cough, whatever the circumstances, the doctor will provide the advice as to whether or not it needs to be face-to-face. So that remains the essence of how our health system is delivered, but to have an entirely new channel that's safe, that's convenient, that's effective, but for the appropriate services, that's just an enormous quantum leap forward for Medicare and for general practice and for health services right across Australia.
Okay, no doubt you don't want to preempt what goes on in National Cabinet today, but the discussion will be centred around the increased load of return travellers from overseas. Do you think the states can handle it?
Absolutely. We've had Jane Halton, a former Secretary of the Finance Department, one of the toughest and most distinguished public servants Australia has ever had, do a top to bottom review of the state hotel quarantine system, and overwhelmingly a positive assessment. Her view is that there's significantly greater capacity that can be utilised, and that's about bringing Australians home. We want to bring home our sons and our daughters, our mums and our dads, our friends and our family from overseas, and we can work with the states to do that. We had higher caps and hotel quarantine capacity before because of the concerns about Victoria. Obviously, we lost the Victorian capacity and some of the states wound back their capacity just to make sure that they were safe. But the Halton Review has looked at that, said there's significant additional capacity, and that means if we can bring home Australians, of course we should bring them home.
The states want federal help, though. They want extra federal assistance. Are you willing to provide that?
Well, the ADF has been on standby and available for states and territories throughout. We know that the ADF has been widely used, obviously not in Victoria, which is the subject of a particular inquiry at the moment, but it's been on offer since the 27th of March, and the ADF will continue to be on offer and will work with the states. It's something for which they assumed responsibility. This is an area where they've performed magnificently, and we want to thank and acknowledge that. And, critically, Australians have to be able to come home, and we're fighting for that, we're delivering that, and we can work with the states to make sure that the 2,500 cases that have been detected and prevented from going into the community in hotel quarantine of COVID-19, that we build on that and safeguard Australians, but bring home our brothers and our sisters, our friends and our family.
It's not easy, though, at the moment, working with the states. Do you admit there is tension between various premiers and the Prime Minister?
Look, we've had a federation since Australia was formed, and there are always challenges. But the National Cabinet period has been one of, if not the closest period of cooperation between states and territories and the Australian government in Australian history. That doesn't mean there are no tensions, but ultimately this is a mechanism for solving problems. It's been an extraordinary step forward. We know that 100 years ago, during the Spanish flu, the states and the federations fractured. It nearly broke apart the country. We learnt from that. The Prime Minister was intensely aware of that history in building the National Cabinet. It served an extraordinary purpose, and it will continue to do that. That doesn't mean people don't have different interests or different views. That's why you have a cabinet, to help reconcile and resolve those views.
Just finally, Minister, there are these anti-lockdown protests that are planned for Melbourne once again this weekend. Have you got a message for anyone who's willing to do that?
Yes, it's exactly the same message that myself, the Prime Minister, the then Chief Medical Officer, Professor Murphy, had in June, and it hasn't changed. There are many ways to express your democratic views. There are powerful vehicles, but protesting in a group at this time is not safe. And it's the same message we had in June, and the same message we've had ever since, that we respect the democratic rights, but the method has to be safe, and the mass protests are not safe. They put people at risk. Please do not do it in a mass protest, online, outside your door. So many of the creative ways where protests can be expressed, but our view has not changed since June, and it's been consistent across all protests, no matter what the cause.
How does that work, though, when you've got New South Wales wanting to increase the number of people going to a stadium to watch football in October? Is there a difference in messaging there?
That's about a COVID-safe approach, where you have names recorded, you have distancing within the stadium, you have individualised seating. And so the whole point of a COVID-safe approach is to be able to safely manage numbers.
Sure.
A close, tightly bunched protest, as it was in June, where we saw the mass protests, as it is now, that isn't a safe way to do it. So there are democratic freedoms which are fundamental. People have to be able to express their views, but the manner in which they express those views needs to be tailored to the safety. And that's about respecting all Australians and respecting their rights to health and safety at the same time as exercising our democratic freedom.
Health Minister Greg Hunt, appreciate your time as always. Thanks so much for joining us here.